Thank you for joining us for our Mental Health Summit. The pandemic and its toll on the mental health of Americans have been described as a dual crisis. But long before the pandemic highlighted the dire state of our nation's mental health, advocates have called for increased access to mental health services and true parity for mental and physical health care. As we mark Mental Health Awareness Month in May, we will be asking what is being done to address the mental health crisis in our country? What steps can be taken to ensure easy access to mental health services? And how do we finally erase the stigma and put mental health and physical health on equal terms? We'll be discussing these topics and more today, throughout the day. I'll be joined by my colleague, Julia Manchester, political reporter at The Hill. Julia, thanks for being with us today.
Thank you.
But before we get underway, a few housekeeping notes. You can tweet us at The Hill Events using the hashtag The Hill Mental Health. We are broadcasting live, and we'll be taking your questions throughout the program. If you experience any trouble with the live stream, please refresh the page. That usually should help. My first guest today is Democratic Congressman Tony Cárdenas, who has represented the 29th District of California since 2013. Last year, he introduced the Health Equity, Access, Resources, and Treatment Package, which includes a number of mental health provisions, such as the strengthening of mental health supports for BIPOC Communities Act and the Youth Suicide Prevention Act. And we're going to talk about your legislation. Welcome, Congressman Cárdenas. Oh, I can't hear him. Okay, Congressman, I'm sorry.
Okay, I muted. Sorry.
Yeah, it's the age we live in.
Yeah,
I can hear you now.
Going on years, and that's the first time that's ever happened to me.
Well, thanks for joining us. You've been a leader in mental health legislation and policy for a long time. Before we get into some legislation and kind of acronyms, where are we in mental health, especially as we deal with the ongoing pandemic?
Well, the great thing is the Affordable Care Act did require that we have equity between mental health services and physical health services when it comes to our insurance policies, when it comes to the federal government, when it comes to local governments. For example, here in California and like most of the country, when it comes to healthcare and the government's involved, that usually happens at the local county level. So it's really important for people to understand that for a long time, it's been really hard for us to get that commitment on mental health, unlike what we've already become accustomed with when it comes to physical health. When it comes to physical health, I think most Americans can feel comfortable that somehow, some way, they're going to be able to access being able to see a doctor. But will they be able to get access to a psychologist, a psychiatrist, or maybe an MSW to help with some mental health or some other issues that have to do with mental health? So we're moving forward, but the thing is, we need to move by leaps and bounds as soon as possible.
You know, just this past weekend, we had the tragic shooting in Buffalo, and I wanted to ask you about that because the parties in some ways have come together on mental health issues. On gun control, Republicans, by and large, have balked, and they've said, hey, this is a mental health issue. What's your response to that?
Well, first and foremost, there are more guns on the streets of America than there are people. So that's an issue that we need to not only grapple with, but actually solve at the federal level and at the local level. But when it comes to mental health, we do have incidents like what happened, and my heart goes out to the families of all the victims in this last two shootings. And it's really important for people to understand that society has a responsibility. We have individual responsibilities, and also mental health does play a part sometimes when it comes to people acting out. And in many cases, if we had a better mental health system locally, we probably would be able to prevent some of these shootings by making sure that we identify what the help that people need, and then they can actually get that help. So again, these kinds of shootings should never happen, but when they do happen, sometimes there could have been or should have been an opportunity for some identification of that person having a mental health issue, and then being able to have that person get some help so that these kinds of incidents don't happen.
And what I think is a great idea, and I've talked to the former commissioner of the FCC on this, the rollout of the 988 hotline for mental health. And you wonder, why didn't this happen before? Because the hotlines to call, you just don't remember. They're very hard. But 988 is obviously easy to remember. Can you tell me kind of a little bit about the background of that and the rollout, which obviously is going to be very important to making sure people can contact the help they need?
Well, let me start with 911. It is robust and it's real, and people everywhere in every part of the country can count on 911. When you call, somebody's going to come and there's going to be someone to help. Now, 988 is specifically for mental health calls, whether it's a suicide situation or somebody's having a mental health crisis. The people who should be showing up are people who have mental health skills, people who can actually help address that issue with that individual and actually take control of the situation and give the help that the person needs. With 988, it's going to start up in the middle of July, and it's something that we need to be as prepared as possible. It's 988 is going to be the number that we can call anywhere in the country, and then we're going to be able to have someone come and so after someone calls, and actually somewhere to go afterwards to get that mental health. Like I said earlier, mental health is something that we need to fortify in this country. 911 is something that we're all accustomed to. When you call 911, an officer shows up or a paramedic, and then after that, they can go to a hospital, and then the situation is handled. But when it comes to mental health calls, we don't have a system yet, and 988 is going to be the system that's going to go live in the middle of July, just in a couple months, and it's going to be something that we need to be as prepared as possible for. I do have legislation on that as well that hopefully is going to help prepare us nationally and locally to be ready for those calls.
Are you concerned, as far as that legislation on 988, are you concerned about resources? How would your legislation shore up and make sure this thing works?
Well, the resources in the long term are going to have to come from the local level. A lot of people don't realize it, but 911 is mostly funded and the infrastructure for it, and it works well now. 911 is fortified by the funds that come from your phone bill. Usually there's a small fee that the states, individual states, actually put on the legislation, and it comes out of the bill every month. A lot of people don't even notice it, but they do know that you can call 911 and the infrastructure is there. 988 needs the same infrastructure. The blueprint is already built. 911 has been around for decades. 988 needs to copy that model so that we can fortify the kind of support that we need at the local level for us to have more mental health workers ready to answer the call, for more mental health workers to be able to help out and be there in the long term to help with the long-term issues that people are facing. And these are the kinds of things that we need to do. My bill actually does some of that, but at the same time, my bill is actually trying to help be an impetus for getting it off the ground so that we can have a 988 system that's ready and available 24/7. It's a community-based response that is going to make it real and work well, just like 911 is a local crisis response effort. We're going to have call centers, mobile crisis teams, crisis centers. My bill will actually help all of those elements get off of the ground. But the real long-term solution is for every state to create the infrastructure and the long-term stream of funds to make sure that it continues, just like we have the stream of funds for 911.
Your legislation that you just mentioned was part of a package called the HEART package that you've introduced. Tell us a little bit about that. You've also introduced legislation on reducing youth suicides. What is the status of that legislation? Could this possibly be attached to something that's moving through the Congress this year? It's tough to pass anything in an election year, as you know.
Yes, it is. But fortunately, we have bipartisan support for HR 7116, which is my 988 bill. And as I mentioned, it's going to fund community-based crisis response facilities, including call centers, mobile crisis teams, crisis centers. It's going to support crisis workforce development and training and scholarship opportunities as well. It's going to increase the care required for health insurance plans to cover crisis services. It's going to allow states the opportunity to establish certified community behavioral health clinics, which will provide comprehensive mental health and substance use services. It's going to implement a national suicide prevention awareness campaign in partnership with a wide array of stakeholders already. It has over 100 local organizations supporting the bill already, and it's going to provide technical assistance for states to implement crisis services and support research for continuous quality improvements, et cetera. So it's a very comprehensive bill. HR 7116 is part of the mental health package that is already slated to go through the Energy and Commerce Committee and to the House floor and to the Senate.
As far as, and I would imagine 988 is going to help do this, but what else can be done as far as you know, Congressman, where you live really depends on what kind of health care you get, whether that's access for minorities to the proper health care or in rural areas. What needs to be done to level that playing field so people are getting the health care they need across the country, not maybe just in urban areas?
Yes, absolutely. And that's one of the reasons why I believe that my Republican colleagues are coming on board, and this is a bipartisan effort. Because when it comes to rural areas, it's even harder to get not only physical health support, but mental health support. In some communities, you have to drive 50 to 100 miles just to see a doctor. And then may have to go twice as far just to be able to see a psychologist or psychiatrist. So this is something that we're going to make sure that we have the infrastructure that is a network across the country, in the biggest cities in America to the most rural communities in America. So this is something that we already have 800 numbers for crisis calls when it comes to mental health or what have you, but we don't have the infrastructure and we don't have the network connected across the country. And 988 is that solution. Now what we need to do is fortify that so that we can make sure that every community, when they pick up the phone and they call 988, they're going to get a response, they're going to get help, they're going to get support.
Telehealth is a big way of practicing medicine that's gotten a lot more popular in the Zoom age and the pandemic age. And I had never done one. And then earlier this month, I got COVID, and I certainly was using telehealth services. Do you think that should be expanded? I mean, it seems like it's been a big success.
Well, you look like you're recovering fine, so I'm glad to see that.
Thank you.
But the thing is, what this pandemic has shown us, that we have holes in our system, and certain communities, for example, poor white families are having just as hard a time in rural America getting to see their doctor as people are in the biggest cities in America. And it's important for people to understand that this COVID crisis, this pandemic, has shown that we need to make our system more fluid and flexible. And then we have allowed, from the federal level on down, we've allowed people to give those services with telehealth. And it's working out much better than most of us actually thought it could or would. And it's handling the issue and giving people more access to quality care than ever before. So there's a handful of us in Washington who are trying to make sure that we keep it open long term, even beyond when this crisis is over.
Congressman, we've run out of time, but thank you so much for joining us today.
You're welcome. This is a very important issue, and mental health is something that we all should be concerned about. It affects every single one of our communities and families, and it's something that we can make sure that we're in a better place in America. So, and the 988 is going to go live in a couple months, ladies and gentlemen, so let's be ready.
Absolutely. I think everyone can agree with that.